Hey guys, this is Dr. Kyle with Columbia River Chiropractic. We're going to be avoiding our tip for Tuesday this week just because we want to continue on our presentation of pediatric focused videos. Last week, you might remember, we talked about ear infections and we talked about colicky babies and maybe constipation issues associated with kiddos. So hopefully you got something out of that in regards to how chiropractic may help with those ailments. This week, I wanted to primarily focus on how chiropractic can help prevent potential issues for kiddos that can eventually become issues for adults later on down the road. One of the things I wanted to address is how kids have lots of falls basically from the day that they start walking. You're going to see kids, I have a 1 and 3 year old, these guys crash all the time, hitting their heads on things, falling off beds, falling off steps, falling off stairs. As we experience these things when we're children, they can actually have major effects on us as we start to develop, because our spinal development can really be influenced by a lot of these crashes in particular. Now, this is based off of an orthopedic law known as the Hutter-Volkmann law. You don't need to remember that term. But what this law states, what it theorizes, is that where you stretch a tissue, it will promote growth of that tissue. Where you compress a tissue, it will stunt growth of that tissue. So in regards to our spinal health, where this law becomes applicable is what's known as JIS. This is called juvenile idiopathic scoliosis. What this basically means is that in our spine, we start to develop a little bit of an S-curve. Now, unfortunately, that name implies idiopathic, that we don't know where this comes from, we don't know how it develops. But if we consider this law and we consider the amount of falls and crashes we take as kids, what can happen very often is, say you fell off your bed and you squished one of your vertebrae on one side, what that will do, and if it stays that way, what that will do was squish it. Hopefully you guys can see that, not the best drawing. Squish it on that side so it'll stunt the growth of that bone, but on the other side where it didn't get squished, it'll continue to grow as normal, so much like your other vertebra. Now what this basically does is set you up for a vertebra that's kind of shaped differently than all the other ones, and every vertebra upwind from that will have to accommodate based on that change in position. So if you look at me, if I were to compress that vertebra on one side, it's like I'm tilting off to the side. But our body is smart enough to know to recover and kind of come back to more of this midline. So that's where you end up developing this S curvature in your spine. Now, as kids, this might be a mild complaint for some of them, causing back pain. As adults, we see it very often in the clinic that this can actually be very compromising to your overall health because of the orientation of your nerves and your spinal cord that have to adapt to this change in curvature. So what I'm trying to ultimately get across to you guys is that identifying when our children take these crash and burns and potentially compromise their spine, it's very important to have a chiropractor assess the function of that spine, because you could be preventing how their spine develops based on that change in movement, based on that change of growth. Again, this is based on just that very simple theory and principle that bone, where it gets squished, it'll compress its growth, and where it's stretched, it'll grow that growth. So where chiropractors come into play is we restore normal motion to the joints between those bones and can hopefully encourage more of a proper spinal development from that point in time. Now, I know this is a little bit of a longer video, but this is actually a very complicated process that I think people don't truly understand in regards to scoliosis. So I just really want to hit home the point of how this can potentially develop and how we can potentially prevent it from becoming a problem when we're adults. So again, I'm Dr. Kyle with Columbia River Chiropractic. Our videos this week are going to focus on the pediatric side of chiropractic, so I encourage you to tune in later in the week when we'll address another hot topic. Give us any feedback on this video, any other questions, please comment, share on Facebook, and hopefully we can keep you guys engaged with this kind of content. Talk to you next time.